based upon many factors. And one of the largest ones can be our microbiota, this intestinal flora.
The gut is so important. We need to make sure we pay attention to that.
Right, that's how it started.
Yeah, that's why we're talking about this. It's so critical. Now, you're going to talk about the role of stress in digestion and the other way around.
Yeah,
digestion and
stress.
Role in stress. Where do you want to start with that?
Yeah, somewhere along the way I realized that things go wrong for tangible reasons. And we have health crises. It's not because something fell on us from Mars. There's some tangible reason behind that. And Dr. Hans Selye, back in the early 1900s, he realized that a lot of different ways that an animal could be unhealthy or agitated or disrupted, a lot of different things would cause the same set of problems to emerge. And he called that stress. I think today we've gotten too narrow of a concept of that term. We think about mental emotional stress, and that could not be more powerful or more important, but it's one small part of the stress spectrum. Being exposed to processed foods, being exposed to pollutants, not having our daily circadian rhythms, those are all stress in a bigger sense. And our intestinal tract is so affected by that strongly. So when things go wrong in there, it first and foremost comes from this total stress load. So to really think about healing this, have that be lasting, those benefits be lasting, we've got to think about what's throwing it off and what's making it not work right to begin with.
So we want to reduce stress. We want to eliminate the stressors as much as we can, realistically.
Much as we can. And there are some that we cannot tangibly reduce all the way. So we want to be aware of them and pluck the low-hanging fruit and take care of what we can, but also use strategies that help to reset the stress response as part of healing the intestinal tract.
Let's nerd out a little bit. Off camera, you said that the stress response can impact functional bowel disease and inflammatory bowel disease.
Yeah.
Give us the geeky version, and I'm going to jump in and kind of clarify things for everybody else. Go for it.
So actual bowel problems, symptoms, in medicine, the first distinction we make is it inflammatory or is it functional? And what that means is there's some measurable chemical trauma present. And the two main disease states there are ulcerative colitis and Crohn's disease. So Crohn's disease is where the colon, the majority of it, has a pretty diffuse, even amount of chronic inflammation. And then ulcerative colitis is similar, but it's more patchy and more diffuse. So some areas are affected, some are not. So first off, those are the two big inflammatory bowel diseases, or IBD. And most everything else is then considered a functional bowel disturbance. It's not a disease of structure, not a measurable physical damage, but it's a disease of function, how things are working. And the main category there that's more commonly thought of would be irritable bowel syndrome.
So give us, be maybe a little bit more specific. So when you're talking about functional bowel disease, what other different disorders